Welcome back to the ECG Interpretation series. In part 1, we learned how to identify ECG leads and understand the basics. Today, we'll cover the most practical part of ECG interpretation: how to calculate heart rate, identify rhythm, determine the cardiac axis, and avoid common mistakes. By the end of this video, you'll have a simple step-by-step approach that you can use for every ECG. Before doing anything else, always start by looking at lead 2, which is usually the rhythm strip printed at the bottom of the ECG. Why lead 2? Because it's the longest continuous recording. It makes rhythm assessment much easier and allows accurate heart rate calculation. So remember, always start with lead 2. The next step is calculating the heart rate. There are two situations: regular rhythm and irregular rhythm. Let's discuss both. If the distance between every R wave is equal, the rhythm is regular. There are two formulas you can use. The first method is heart rate equals 300 divided by the number of large boxes between two consecutive R waves. The second method is heart rate equals 1500 divided by the number of small boxes between two R waves. For example, suppose there are 4 large boxes between two R waves. Heart rate equals 300 divided by 4, which gives 75 beats per minute. Simple and quick. Now, why do we use 300? Many students memorize the formula but never understand where it comes from. Let's calculate it. 1 minute equals 60 seconds. One large ECG box represents 0.2 seconds. That means in 1 second, there are 5 large boxes. In 60 seconds, there are 5 multiplied by 60, which equals 300 large boxes. So 300 large boxes represent 1 minute. That's why we divide 300 by the number of large boxes between two R waves. Now suppose the rhythm is irregular. The RR interval keeps changing, so the previous formula no longer works. Instead, count the number of QRS complexes in 30 large boxes, then multiply that number by 10. For example, if you count 8 QRS complexes, the heart rate is 8 multiplied by 10, which equals 80 beats per minute. A useful shortcut is to count 15 large boxes and multiply by 20. One important point: always calculate the heart rate using the bottom rhythm strip in lead 2 because it is longer and much easier to count accurately. After calculating the heart rate, the next question is the rhythm regular or irregular? There are 3 possibilities. First is regular rhythm. Measure the RR interval. If every RR interval is equal, the rhythm is regular. Second is irregularly irregular rhythm. Here, the RR interval varies continuously. There is no repeating pattern. Every beat is unpredictable. The classic example is atrial fibrillation. Whenever you see an ECG with completely random RR intervals, think of atrial fibrillation. Third is regularly irregular rhythm. This sounds confusing, but it's actually simple. The RR intervals are not equal, yet there is an underlying pattern. Some QRS complexes are dropped at regular intervals. The classic example is heart block. So remember, pattern present with dropped beats equals regularly irregular rhythm. Now let's determine the QRS axis. The axis tells us the overall direction of ventricular depolarization. There are 4 major categories. Normal axis lies between minus 30 degrees and plus 90 degrees, with an average of approximately plus 60 degrees. Left axis deviation lies between minus 30 degrees and minus 90 degrees. The electrical axis shifts more towards the left. Right axis deviation lies between plus 90 degrees and plus 180 degrees. The electrical axis shifts towards the right. Extreme axis deviation lies between minus 90 degrees and minus 180 degrees. This is also called the northwest axis. If you don't want to memorize the axis wheel, here's a simple trick. Look only at lead 1 and lead 3. If the QRS complexes point towards each other, think of right axis deviation. If the QRS complexes point away from each other, think of left axis deviation. This shortcut is useful during exams and bedside interpretation. Now let's finish with some common mistakes. The first mistake is wrong ECG paper speed. The normal paper speed is 25 millimeters per second. If the paper speed is more than 25 millimeters per second, the ECG appears stretched, making the heart rate falsely slow and producing fake bradycardia. If the paper speed is slower than 25 millimeters per second, the ECG appears compressed, giving a falsely fast heart rate and producing fake tachycardia. Always check the paper speed before interpreting an ECG. The second mistake is poor electrode contact. Loose electrodes produce noisy ECGs and artifacts. Always ensure proper skin preparation, good electrode gel, and firm skin contact before recording the ECG. Whenever you receive an ECG, follow this sequence every single time. First, calculate the rate. Second, identify the rhythm. Third, determine the axis. Finally, make the diagnosis. Remember this simple sequence. If you follow these 4 steps consistently, ECG interpretation becomes much easier. That's it for ECG Interpretation Part 2. If you found this video useful, don't forget to like, share, and subscribe to Anesthesia Talk for more anesthesia, critical care, and ECG learning videos. Download the handwritten notes from the subscriber channel on Instagram. Thanks for watching, and I'll see you in the next video.